Welcome to NCLEX Map. Thank you for joining us at NCLEX Map, your trusted source for high-level NCLEX RN preparation. This presentation contains 15 challenging, evidence-based questions aligned with the 2023 NCLEX test plan. Designed by nurse educators, these questions will sharpen your clinical judgment and help prioritize patient safety. Let's dive in and prepare for NCLEX success. A client with COPD presents with confusion, a respiratory rate of 8 min and SpO2 of 88% on room air. Which intervention should the nurse implement first? The correct answer is A. Administer low-flow oxygen via nasal cannula. Rationale: low-flow oxygen treats hypoxia while minimizing CO2 retention. Initiating oxygen addresses the immediate life-threatening issue. A nurse is caring for a diabetic client receiving insulin glargine and Lispro. Which action is appropriate? The correct answer is B. Administer glargine in the morning and Lispro before meals. Rationale: glargine provides basal coverage. Lispro is rapid-acting and given before meals. They are administered separately and not mixed. Which task is appropriate for the nurse to delegate to an experienced UAP? The correct answer is C. Ambulate a stable post-operative client 12 hours after surgery. Rationale: UAPs can assist with routine tasks on stable clients. The other tasks require assessment, education, or clinical judgment. Which client is at highest risk for falls? The correct answer is B. A 75-year-old with confusion and frequent toileting needs. Rationale: advanced age, cognitive impairment, and increased mobility needs all contribute to higher fall risk. A nurse assesses a postpartum client with a boggy uterus and heavy lochia. What is the priority action? The correct answer is B. Massage the fundus. Rationale: a boggy uterus indicates uterine atony, and fundal massage is the first-line intervention to stimulate contraction and control bleeding. A client hospitalized for major depressive disorder says, "I won't be a problem much longer." What is the priority nursing action? The correct answer is B. Notify the healthcare provider immediately. Rationale: the statement indicates suicidal ideation. Immediate notification ensures safety interventions can be initiated. A 3-year-old with croup presence with stridor and nasal flaring. Which intervention is most appropriate? The correct answer is A. Administer racemic epinephrine via nebulizer. Rationale: racemic epinephrine reduces airway inflammation and improves stridor. Fluids and cultures are secondary priorities. A client presents with right-sided weakness and facial droop. CT confirms ischemic stroke. What is the priority before administering alteplase TPA? The correct answer is A. Confirm blood pressure is below 110 mmHg. Rationale: elevated BP increases risk for hemorrhage with TPA. BP must be managed before administration. A client with suspected tuberculosis is admitted. Which action should the nurse take first? The correct answer is A. Initiate airborne precautions. Rationale: TB requires immediate airborne isolation to prevent transmission. The other steps follow but are not first. A terminally ill client refuses pain medication, stating they want to remain alert for family. What is the best nursing response? The correct answer is B. You have the right to refuse medication. Rationale: respect for autonomy is central to ethical nursing practice. The client can refuse treatment even if it leads to discomfort. A client with chest pain and ECG showing ST elevation is scheduled for emergent PCI. What is the priority assessment? The correct answer is B. Allergies to contrast dye. Rationale: contrast dye allergy could cause anaphylaxis during PCI. This must be assessed and pre-treated if needed. Which finding in a client with small bowel obstruction requires immediate action? The correct answer is C. HR 30, BP 82/60, dry mucous membranes. Rationale: signs of hypovolemia and shock from third spacing and fluid loss require immediate intervention. A client with diabetic ketoacidosis DKA has glucose of 610 mg/dL, pH 7.12, and serum potassium of 3.1 mg/L. Which intervention is a priority? The correct answer is C. Replace potassium before insulin therapy. Rationale: insulin lowers potassium further. Hypokalemia must be corrected to prevent arrhythmias before insulin administration. A client receiving chemotherapy has an absolute neutrophil count, ANC, of 400 BAL-3. Which action is appropriate? The correct answer is B. Use dedicated equipment and restrict visitors. Rationale: ANC 500 indicates severe neutropenia. Infection prevention measures, including visitor restriction and dedicated equipment, are essential. A client receiving hemodialysis reports nausea, headache, and muscle cramps during treatment. What should the nurse do first? The correct answer is B. Decrease the rate of dialysis. Rationale: these are signs of dialysis disequilibrium syndrome. Slowing the rate reduces the fluid and solute shift, causing cerebral edema. Thank you for watching. We hope you found these NCLEX-style questions helpful and insightful. Don't forget to subscribe, like, and share this content with your fellow nursing students. Join our community at NCLEX Map for more expert-crafted materials, updated nursing resources, and real-world practice questions. Your success is our passion. Let's conquer NCLEX together.